so happy to have Stefanie Remson, the Rheumatoid Arthritis Coach. She is, you can see her full bio that Lauren, our wonderful volunteer, posted, and we're so happy to have her. She, like many of other speakers, wears multiple hats. So she has rheumatoid arthritis and is a family nurse practitioner. So that's just a wonderful combination of understanding the patient side of things and also the back end, the systems and behind how things work. And she also works as a rheumatoid arthritis coach, helping people with rheumatoid arthritis learn to live full, productive lives, which is so perfectly congruent with this event. So thank you so much, Stefanie. I'm going to end the poll and share the results just in case anyone's interested. It was 64% of attendees have had difficulty navigating the health system and 36 haven't. So I'll stop sharing that so you can take it away.
Awesome. Thank you. Can you hear me okay? Awesome. Thank you all for having me. Before I start, do you like my gloves? These are the Grace and Able compression gloves. So I wore them today. So let me share my screen. Okay. Okay. My name is Stefanie. I'm the Rheumatoid Arthritis Coach. I'm going to introduce myself and then I'm actually going to turn off my camera. I find looking at myself is really distracting. So I'm going to talk to you today about navigating the healthcare system with insider insight. So I'm the insider. Just a little about me. My name is Stefanie. I'm also the Rheumatoid Arthritis Coach. I'm a family nurse practitioner in the state of Nevada. I also have rheumatoid arthritis. I'm also a patient, so I get it. I get both ends of it. These are my contacts. Feel free to screenshot this if you want to reach out or follow me. This is my info. Okay, and I'm gonna turn off my video right there. I am still here. Okay. So before I do anything, I have no financial disclosures to give this presentation. This presentation is 100% voluntary. I have no financial gain being here today. Just so you know too, this presentation was written for US-based medical care. I do not have experience or licensure in any other healthcare system outside of the US. And please remember, this does not serve as medical treatment or recommendations and should not be used as such. This is not medical advice. So navigating the healthcare system can be frustrating, exhausting, and full of dead ends and rabbit holes. We've all been there. Having a chronic illness makes navigating the way even harder. Being sick, having a chronic illness that we carry every day makes being a part of the system harder, right? Because it's never ending. So I'm going to share some insider insight. Before I show you the tips and tricks to making the most of your time, here's some insider insight I would like to share with you from a professional's perspective. So first, let's talk about COVID-19. I know you're all very tired of hearing about it, but the COVID-19 pandemic has increased the burden of the healthcare system to meet the high demands of caring for these COVID-19 patients. This has forced most healthcare facilities to modify access to services, office space, and even how services are delivered. These changes have further complicated navigating the system. Not sure if you noticed, but a lot of healthcare facilities either went out of business or started doing telehealth, now exclusively do telehealth, they share an office space, et cetera, et cetera. So it's also, COVID-19 has also really complicated working in the healthcare system, organizing the healthcare system, hiring healthcare professionals, communicating within the healthcare system, right? Anytime you change how things are structured, it's harder to talk between them. So et cetera, et cetera, et cetera. So keep in mind, everything involving healthcare is harder since COVID-19, okay? Don't forget, healthcare workers get sick too, just like your local fast food chain closing their dining room, trash not getting picked up, and schools closing due to staffing. Healthcare struggles to staff positions too. Everyone from physicians to billers to people who clean the office building and take out the trash gets sick. The entire world is short-staffed. Remember to please be kind to the ones that showed up today, okay? So here's just a little perspective. Imagine if you owned a pizzeria. You had this company or this family company, you owned a pizzeria, and in January of 2020, you made 40 pizzas a day. You made ends meet, you took home a good profit, you had to hire a new staff member maybe 3 times a year. You know, the local teenager would come in to help clean at night. And then in March 2020, you had daily orders for 400 plus pizzas a day, and it continued for 2 years with no end in sight. There are no new medical people coming out of school in your area. There are no people applying for your jobs, right? So it doesn't make your health concerns any less valid. You are not any less important. You are not any less urgent. I just share this so that you know and have a little perspective. You are important, and we really do get it. So keep in mind, just a summary, working in healthcare is really hard. We don't get to turn off the engine before working on it like mechanics. We don't have anyone else to pick up our kids when the bell rings at 3. When school was closed last year, where I live in Nevada, I had nobody to care for my children. A healthcare emergency can often mean life or death. That's a big burden to bear. And be kind when talking with healthcare workers. So moving on, why you guys all came today, let's talk about navigating the healthcare system. So some people will say, why do you want to be better? Why do I care? Right? Why should I be good at this? So first of all, if you want something done right, you have to do it yourself, right? We've all heard this. It's so true, right? For everything in life. So if you want your healthcare directed appropriately and managed correctly, sometimes you have to take the reins. When you know the ins and outs of healthcare and managing your own healthcare, you can usually save money. Everyone wants to save money. Saving money on a prescription, a copay, even the cost of gas to get there and back can help budgeting for chronic illness, right? So everybody wants to save money. So if you take the reins of your healthcare, that's one benefit. Next, people who are more active in their care usually report higher satisfaction. This means that they're happier with the care that they receive. Navigating the system efficiently can save you time. Who doesn't want more time, right? Everybody wants some of their time back, especially when we struggle with chronic illness. And like Eileen shared, chronic fatigue or pain, we all want more time. So a great example of this is if you know you need a study of some kind. So if you know that you need an X-ray before an MRI will be approved on your insurance, or maybe you need to see a different specialist before a certain prescription can be approved, you might be able to save a whole office visit. It's very empowering to be in control of your own health. So I'm a healthcare professional and I'm also an RA patient. So I get it. So that's my healthcare professional viewpoint, but then I'm also an RA patient. And believe me, it's not perfect for me at all by any means. It's tricky to navigate. It's tricky to be in control of your health, but I do have some great tips for navigating the healthcare system here in the US. So first and foremost, find a provider that's contracted with your insurance plan. So many times people will talk to me and say, oh, I heard that Dr. Martin is absolutely fabulous. I want to see him. And they go through all of the hurdles of calling and scheduling, and whatever happens, they get there, they sit down to see the doctor, to be roomed or whatnot, and they're not even contracted. So they couldn't see them anyway, or maybe they saw them once and then they found out later they weren't contracted and couldn't see them again. So before you do anything, start with finding somebody that's contracted with your plan. The easiest way to do this is to just call your insurance. Call them up, ask them for a list of contracted providers. Rheumatology is quite a small specialty, so your list won't be hundreds, right? If you call and ask for contracted primary care, it's very long. Usually you can narrow it down by zip code, but just call and ask for contracted providers. They'll give you a list. After you get this list, then ask people for referrals based on the list. Then you take that list back to your primary, back to your friends, back to your support group, wherever you go. Okay, so start there. Well, you're already on the phone with them because you already called them, and probably you waited quite a while on hold to speak with somebody. So while you're on the phone, ask them for a list of their prescription formulary. This is so simple. This is the list that tells you exactly what medications are covered and at what tier. So a tier is the cost. Usually there are 3 tiers, and this is how much they cost you out of pocket, with tier 1 typically being the cheapest. So this is with anything in life, right? Even designer handbags, right? They're all tiers. The cost of things are on tiers. You can call and they will give you a list. Be sure to bring this list with you to your appointments. It's so much easier to go off of a list that you have, that you know things will be covered, or even if you know that maybe this medication that you want to try, your rheumatologist wants you to be on, is a very high tier, which means it's the most expensive of all the options. At least you know going into it. There's no aftershocks, there's no surprise, there's no unanticipated paperwork, right? So get your prescription formulary. A little tip here is a lot of insurances, you can actually Google this, especially the big ones. You can Google whatever your insurance is, prescription formulary, and it'll pop up. Also, rheumatology medication options are quite small, right? We're not talking blood pressure meds or diabetic meds, right? So there's quite a small list. So when you Google it, usually even if you're a little bit off with the exact plan, right? Because we all have those plans that have the of the state after them. So even if you're a little bit off, usually the tiers will still direct you in the right place, at least where to start. So what do you do if your medications still aren't covered or are still too expensive, right? We get this all the time. Maybe your tier 1 is still too expensive. Maybe you did go off of the list and it's thousands of dollars a month. I've had patients and clients that, live in a town over from where the infusion center is. And then every time they go to the infusion center, they are, expected to pay the copay and the administrative fees of going to the infusion center. And even just between gas and those copays, it's still very expensive. So what do you do? So first of all, just ask your medical office staff to do a prior authorization. For slang, we call it a PA, AKA PA, right? So on the phone, if you hear somebody say, oh, we need to do a PA, that's what it is. Sometimes the medical office can do this simple application for you that can really reduce the cost. I put medical office on the slide because really any medical office can likely help you. You might be surprised at which specialty would be willing to help you do some paperwork. Okay, so you just ask. Next, contact the drug company directly, right? This one, there are so many assistance programs for medications used to treat RA. Every time a new medication comes out, they come out with a new assistance program. Definitely go to the website. Now, often these applications are quite lengthy. Sometimes they're like 3 or 4 pages. It is completely worth it in the end. Usually the application is good for 12 months of the prescription. And then when you have to renew it, so let's say you're on X medication for 2 years, the 3rd year comes up, usually you can use all of the same data from the first form. Now, let's say you're on a medication and you don't know the drug company, just Google it. They have fine-tuned their marketing so well, it'll come right up. Ask the pharmacy. This one I love because sometimes pharmacies know about programs, applications, or coupons. So first of all, they know because you're not the only patient on X medication, right? You're not the only person who've ever walked into their pharmacy and filled something. So sometimes maybe the pharmacy staff doesn't know directly, but they have run so many coupons and so many prior auths and so many assistance programs on other medications. Sometimes just through that exposure and volume, they find out about stuff. It's actually really neat. So ask your pharmacy. Also, if you use or have a smaller or specialty pharmacy in your area, where I live in most bigger cities, we have these little mom and pop pharmacies. A lot of them offer delivery. A lot of them specialize in certain diagnoses and certain medications. Sometimes they even have special deals with the drug makers to get them cheaper. But really, if the smaller pharmacy does a lot of X medication, like we said earlier, they might also have a lot of volume and be exposed to those coupons. Ask your rheumatologist office if they have any advice. Sometimes they will have other patients on the same medications. They also have contacts for local pharmacies. I put here big pharma because that's the drug company. That's what we call it for playing, or contracts with distributors and might be able to connect you with the right people. So just ask them. You're not the first person that's been put on a medication that wasn't covered or was too expensive. Okay, they're ready for you. So let's get back to navigating the healthcare system. So sometimes getting something done is a matter of calling on the phone versus showing up in person versus getting the right person, right? So I can't tell you how many times people will come into the office completely livid, so mad because they called 5 times and they still don't have the answer that they need. Sometimes the front office will tell them, well, you need to do that particular action in person. We can't do that over the phone, or we can't give that information over the phone. And it'll be a policy that we don't give that information over the phone. Sometimes it's a matter of something being off-site. You know, sometimes people will come in and have questions about, let's say, billing. A lot of offices do billing off-site now. So coming into the office or calling the office directly isn't really helpful. Also, getting the right person is really key too. You know, if you're waiting for prior authorization for something, or maybe you're waiting for FMLA paperwork or a sick note, something like that. Maybe you're waiting for a prescription refill, right? These are all kind of different designations in the office. The same person doesn't do all of those things. So sometimes it's getting the right person. So if one way doesn't work, try the other, okay? So insanity is doing the same thing over and over and expecting different results. I love this quote because it's so true. You know, if you're calling your office, you're calling and calling and calling, and you're not getting the answers you need, change it up, right? Politely ask to speak to somebody else, or even try to go into the office and politely ask them for help. So always go into the relationship with the office and the staff with the anticipation that it's going to be long-term, right? When you walk into the office, be polite. Don't act like this is your only time that you're going to be there. And, you know, just have some gentleness about you. Be kind, be respectful, be polite. Okay, that it's not a fast food restaurant. It's where you're going to be going every month, twice a year, whatnot, for a long time. You're going to develop relationships with these people. So make sure that you act in kindness and respect and invest in a long-term relationship. Remember, you can catch more flies with honey than with vinegar. It's so true. If you go into this and you're kind and polite, it's just human nature. Medical professionals and all humans want to help kinder humans, right? So just be kind. Go into it with a long-term commitment. Whenever possible, complete the office or facility registration paperwork ahead of time. So most places actually offer it online, or they'll give it to you ahead if you stop by. A lot of places have it online, and you can even fill it out electronically, which I think is really helpful because then it just uploads into their system. But we all know, we've all been there to check in, and they hand us this stack of 10, 20 pages, right? And it's, you know, your insurance, your social security, your firstborn, your emergency contact. Just kidding about the firstborn, but bring any and all records you have early too. And we're going to talk about this later. But whenever possible, complete that paperwork ahead of time. Don't let that cut into your office time. Here's some more insider insight I just like to share. So often there's a delay in scanning documents into the electronic health system. So remember, if most offices now are electronic, and if you have a paper copy of an MRI that was done 10 years ago, right, which many of us do because it's a chronic illness, we've had it for years, maybe even decades, right? So you bring in this paper, somehow that paper has to get into the computer. And as you know, privacy laws make things very difficult to communicate in healthcare. So it takes a while to get it scanned in. It's really helpful if you give plenty of time to scan in these documents. So remember that these types of jobs, like scanning, are given the lowest priority right now because we have patients that are face-to-face with us that need attention and need care. The scanning and the people that sit in the back and organize the paperwork are the people that we've had to shuffle back out to the front because, as I said earlier, the whole world is short-staffed. right? So be kind. There's nothing worse than going into a visit and the medical office not having your records, but to come back and yell or argue about it, it really just doesn't help. Okay, and we're going to get to this later. So give plenty of time to have your documents added. So wait times. Everybody talks about wait times, right? So where I live in Nevada, it is a good 6-month wait right now to see a rheumatologist as a new patient. It's a good solid 6 months, and that's if you are very lucky. So I don't know how it is where you live. Some places are better. Some are even longer, I've heard. So even if it's 3-6 months away, whatever it is, just book it. They say, you know, today is February. They say October 30th is our first available. Just say, okay, book it. Whatever time they say, book it. It's a lot easier to move an appointment up than to start from scratch. Okay, because you have to remember there's data entry that goes into putting a new patient in the system. So if you already put everything in, right? You have Stefanie Remson and my birthday, my diagnosis, you have all my documents in there, and then you call to ask for a cancellation, which is the next thing on the slide. It's a lot easier for the person on the phone to take 10 seconds to just change your date and time than to start completely over. Okay, so keep that in mind. Just book it, whatever it is, just book it. Remember too, you can call the office every day and ask for cancellations. There are always cancellations. Be polite, call every day. Okay, a lot of times the office will tell you, oh, we'll call you. Maybe just slow down. Maybe just call every other day. You can also politely show up and wait in the waiting room. This works a lot of times. It might not work on your first day or your second day. You might waste a lot of time sitting in offices, but this will help you get seen sooner for sure. If you just go in and politely say, hey, can I just hang out here? And if you have a no-show, that's what we call it, a no-show, when people don't make it to their appointment or last minute cancellation, they'll pull you back. Remember, things change all the time. People have emergencies, people move out of town last minute, right? People lose or change transportation, right? So there are always last minute openings. And if you're already in the waiting room and that front desk has you already checked in and kind of like ready to move if there's an opening, you'll get in a lot faster. The key here is to be polite, okay? Don't be pushy. Don't expect to be seen, but it really does work sometimes. So each patient experience is really different. Just because someone had a good experience with an office or a provider doesn't guarantee it'll be great for you. This is so important because where I live, I've had so many people say, oh, and these are, of course, example names, but Dr. Martin is amazing. She changed my life forever. And Dr. X, he gave me this prescription that I had an allergy to, and we were not a good fit. You might go see that doctor or rheumatologist or mid-level or whoever, right? A nurse practitioner, because I'm biased, and you might not mesh with them, or you might not maybe be so comfortable with the options that they give you. Remember that there are different needs, personality fits, and different priorities between patients. Okay, so between you and your neighbor and her daughter, you all might need and want something different out of a rheumatologist. Okay, so just because somebody else loved it doesn't mean you're going to. And just because you love it doesn't mean somebody else will either. Always get a referral. So in America, again, this is US-based healthcare, but there's a lot of great insurances that people have that, advertise doesn't require a referral. And it's true. It doesn't require a referral for the insurance to pay. However, it doesn't matter if your insurance requires it. A referral is how we communicate with each other and clarify exactly why you're seeing this person. So it's basically your provider, like your primary care provider, writing a note to your rheumatologist. I've already done X, Y, and Z. Please see them for this diagnosis. X, Y, and Z did not work. This is why I need your help. I'm bringing you in on the team, right? So also it's really important to have those referrals for communication to document your other providers. If you have a primary care provider and your rheumatologist needs to communicate with them, if you have the referral there, it's a lot easier. A lot of systems too have referrals kind of built into their system. There's all these big health networks on the East Coast, in the Midwest, and all the way on the West Coast, that the referrals are just uploaded. So it makes communication a lot easier. So always just get one, okay? Remember, every medical provider's training, experience, and comfort level is a little bit different. So every provider you meet maybe wasn't trained to do joint injections or to use ultrasound, right? Maybe some providers can interpret their own imaging like X-ray, CT, MRI, and maybe some cannot. And they rely on the radiology read, right? So remember that all of medical professionals training is just a little bit different. So it's important that if you want something very specific, when you call, ask them if they offer that or if they ever do that service. And then if you are in the visit and they say, oh yes, I'm trained in ultrasound, right? And you want ultrasound treatment because it's worked for you in the past or your last provider did it or whatnot, then you know it's a good fit. Bring a friend. Always bring somebody with you. It always helps to have a second set of ears and eyes at your appointments. Okay, we forget stuff, right? Your spouse, friend, or family member might have different questions to ask. I really like this one because I find spouses always have very different questions. They care about your long-term health very much, right? Also, I think that spouses tend to bring up more questions about intimacy and trying to conceive or pregnancy. And sometimes as patients, we don't prioritize those, right? So it's important to bring somebody for the second set of eyes and ears, and maybe they have different questions. Most importantly, always bring a friend if you're having a procedure of any kind. You really don't know how you're going to do. I can't tell you how many times people said, oh, I've had that procedure before and was fine, and they end up passing out in the office, which is fine. We will take great care of you. No big deal. But if you bring a friend, it's a lot easier to get you back home. Okay, so always bring somebody. And to be completely vulnerable, I've actually done this. I've gone in for a procedure and had a little episode. So it's not very uncommon. So let's talk a little bit about second opinions. This is a really, really big one in rheumatology, right? So the key to second opinions is when you're requesting one, be open and upfront right away. Say, I'm here to request a second opinion. Not being upfront and seeking the same treatment from a similar medical professional is actually a form of insurance fraud, and it's not taken lightly, more so in America with Medicare and Medicaid. So it actually, as a medical professional, I have to tell you, it actually gets us in a lot of trouble if we start, we call it double dipping, right? We start billing for the same services, and you can see why when I say it that way, right? Of course, none of you are trying to do that. Of course, as patients, we are never aiming to do that. But it's a big deal. So be open. Say you're here for a second opinion. Think of a second opinion as a date. You're basically saying, I'm currently in a relationship, but I want to see what you have to offer in case I want to leave my current relationship. That's a lot of pressure. Okay, so keep that in mind when you go. You want to be really upfront. Also, about second opinions, you want to be clear on what you want. You know, if you want other medication options or help getting your medications approved, maybe you switched offices or are looking to switch offices because one has an infusion center or one has a better whatever service you're looking for. Maybe they have a acupuncturist in the office, right? So you're looking for alternative treatments. If you're looking for a complete rework of your diagnosis, be open and upfront. Say, I'm not really sure about this diagnosis. Can you tell me if I had the appropriate workup, anything else you'd recommend, right? Make sure you're clear that you want either a reworked diagnosis or completely handing over your care. Also, there's a lot of, well, let me back on that. There are not a lot, but there are a handful of specialists that only do pregnancy in rheumatological diseases. So if you're only there for your period of trying to conceive or during a pregnancy, be honest and upfront with them. Or if you're looking for a second opinion because you heard that Dr. Martin in 2 towns over was really great with medications in pregnancy and management of RA in pregnancy, be honest. Tell them that, right? It's so important that you do disclose that too, because sometimes as a provider and as a patient, I've had providers tell me, I've gone into a rheumatology office and I said, hey, I'm here to switch, sometimes the provider will say, I'm no better than Dr. Martin. I have nothing more to offer you than Dr. Martin. I appreciate you coming here today. I'm flattered, but I think you're in really good hands and you've had a really good workup. I've actually had that myself. And that in itself is actually a great peace of mind, right? Because then but it's really important to be open and upfront. So bring all of your records from the previous providers too. This includes office notes. So that's the note that providers take that outlines your plan of care and medications, etc. Labs, imaging includes X-ray, CT, MRI, ultrasound, and all of your prescription history. And we're going to get to that a little bit more. Remember, the grass is not always greener on the other side. It's great to go out there and get multiple opinions, especially if there are other towns or offices around you that are maybe more progressive. Maybe there's a university-based healthcare system close by. That's great. Just remember, the grass isn't always greener, okay? The grass is really greener where you water it. So if you're leaving an office because maybe the staff or maybe they didn't do your PA quick enough and you're frustrated, just remember, sometimes a little TLC to that relationship is all it needs, okay? So back to navigating the system a little bit. Take notes at your appointments. Sometimes we need to process and recollect our thoughts before asking questions. If you're going to record your visit, you have to let them know. So going back to taking notes, I put these two pictures here because this small little notebook and a pen actually gives me chest pain thinking about trying to take notes on that with my RA hands. So I usually take notes in my phone. And I have to tell you, as a provider, when patients take notes in their phone, it's difficult to tell if they're taking notes or scrolling social media, right? Make sure if you're taking notes on your electronic device, whatever it is, make sure you tell them, I'm just taking notes. Otherwise, it can be distracting, or it can feel like a little bit of disrespect, like you're distracted or doing something else. So be open and upfront. I'm taking notes on my smartphone or my tablet. If you're going to record your visit, you have to let them know. Some offices have really strict policies, but a lot of them will give you an exception. Where I currently work, we actually have a little waiver that you can sign about recording. Just let them know, especially if you're going to video it. A side note, if you're going to be on FaceTime or some sort of video telephone with somebody else, please let them know. Say, hey, my mom couldn't be here today because she lives 3,000 miles away, so I have her on my phone. Okay, let us know. Immunization records have become so important in the last 12 months, right? Whoever thought your childhood vaccinations would be so important to have with these COVID vaccines lately? But keep a copy of yours handy. Okay, be sure you registered with your local county or state vaccination tracking system if you have one. If you don't know what it is, ask your medical team. Your pharmacy will have access to this, or even a Google search. For example, I live in Nevada, and in Nevada, our vaccination recording system is called WebIZ. You just log on, you actually just put in your name and birthday, and you can print your vaccination records. There's always a certain year that it records to. Ours is quite new, so I think it only records the last couple of decades. So if you're older than that, your childhood vaccines won't be on there, so you'll have to use your old school handwritten ones. But it's really important that you do have a copy of this, especially now, even to, sometimes get on a plane or travel at all, we need to show proof of this vaccination. Part of navigating the healthcare system is keeping yourself organized as a patient. Make your own personal health record, PHR. What is a PHR? This is where you collect and organize all of your notes, labs, imaging, and hospitalizations in one document. I recommend this to be both printed, like hard copy paper, and electronic. It's helpful to all of your providers, but also essential in an emergency, right? You get really sick, you need some documents, grab this binder or electronic document, easy. When making a PHR, start with your health insurance company. Many insurance companies offer a platform that can store everything in one place. Those big insurance companies I talked about on the East Coast, Midwest, and West Coast, they actually have a platform right on their main website that you can make your own PHR and store all these documents. If they don't have one, like in Nevada, we do not have one for the insurance that I personally have. There are so many for purchase in the App Store on your phone or other electronic device. There's also ones available through medical research companies or universities. And then don't forget, there's always old school Google Drive, free scanning apps on your phone, old-fashioned PDFs, right? You just email stuff to yourself. Yeah, it's very easy. This is a great opportunity to screenshot. So this is everything that your PHR should include. So your full name and address. Whoops, sorry. Your full name and address, emergency contacts, medical power of attorney, all of your healthcare providers, including dentists, ophthalmologists, plastic surgeons. Yes, you should even include where you get your Botox or Dysport. Health insurance info, including photos of the cards. Try to never transcribe your information yourself. Just put photos in there. Medications, dosages, and pharmacy used. If you don't have a list of this made, take photos of the bottles. Also, your pharmacy will provide you a great list. Allergies, including medications, food, environmental. Family history. This is really significant because if somebody in your family was diagnosed with something and you need to do extra screening, or maybe somebody in your family had a severe allergy to a medication, it's really important to know. Surgical history, especially any joint issues or joint replacements, any hardware. All pertinent medical notes, including hospital admissions, consults, discharge summaries, specialty notes, and any in-office testing, right? How many times have we gone to see a specialist that has a very high-end office with a lot of equipment? They do an x-ray in the office. It's very difficult to find that x-ray again. Make sure you get a copy of it and put it in your PHR. Immunization record, last eye exam, dental exam, mammogram, all of that screening stuff that we do. And then don't forget to include all your labs that have ever been done and where they were done. A lot of times we use different labs for different things. Sometimes things are what we call a send out. There's also that new lab, the newer lab, the Vectra and Vectra, where I live is specific to one lab. So patients might have labs done at all different places, right? So I hope you all got a chance to screenshot that. So just a little bit about me. Like I said, I am the rheumatoid arthritis coach. When you do coach one-on-one with me, this is what you get. Not only do you get help navigating your healthcare system, but I will transcribe your medical record, or will translate your medical records so you can understand them. I'll help you manage your healthcare team through communication, personalized education about your diagnosis, helpful tips, et cetera, et cetera. Just in closing, thank you very much for having me today and listening to my talk. This is all of my contact info again. If you guys want to reach me, reach out anytime. Okay, and I'll turn it back to Cheryl to open up for questions.
Thank you so much, Stefanie. It really is difficult to get used to the job of being a chronic illness patient. So these tips are super helpful. A couple of people have asked about, and can you stop sharing your screen for it when just in a second, just a second, I'm not trying to rush you, just so we can see your face, because that's kind of fun for people. A few people are wondering, is it normal to feel really rushed by your rheumatologist? As someone said, is it normal to feel rushed as if there is a master plan and you being there is just a required step versus a depth of conversation? Oh, something I can't hear you.
Sorry about that.
That's okay.
So that's a tough question. There's two sides of it. So first of all, healthcare is unfortunately always rushed, and it just kind of sucks. As a medical provider, they don't give us enough time to do what we need to do, right? So I'm sorry that you do feel that way. Medicine is an art for sure, and usually when you get better at it, you make people feel not rushed. The flip side of it is a lot of medical care, especially rheumatology, is guideline based, which means that the ACR and EULAR tell us what to do. So if you fail on this medication, you go to this one. If you fail on this one, you go to this one. So sometimes there is a protocol already. So not that you're a burden or a bother, but sometimes there's only one more option for you, or they've already made their plan regardless of how you feel. This is the next step. So I don't know that that makes patients feel better, but at least it's a better understanding.
Yeah, I think it helps to realize it's not personal to you. It's part of a larger system. And I don't know if this is maybe a little bit of a follow-up question. Someone's wondering, is there a way to get longer appointments? Like, I know at one point my rheumatologist, I think she scheduled me for like a complex visit, which was like 30 minutes versus 20. I don't know if that's normally a thing.
You can definitely ask. Every office is a little bit different. Studies have proven over and over across healthcare in general that morning visits are less rushed. Morning visits, the providers are also more fresh. These have been, I've read dozens of studies that say this. So if you do want more time, schedule in the morning. Try to avoid the lunch hour visits, right? Because those are, unfortunately, those are just the rushed visits. As you know, if you go to Walmart at a lunch hour, right, it's always, they scan a little faster, right? So
yeah, I know. Sometimes I ask if it's going to be a midday appointment, when is the doctor's lunch or the provider's lunch? Because then you don't want to be the last one before lunch. You want to be the first one after lunch, I think,
right?
Because then they're a little bit refreshed. Yeah.
Or even, I know we shouldn't judge or put stipulations, but I have small children, and most of the patients that I see know I have small children, and I have to pick them up at 3:19. And so they know that if they're there at like the 2:40 appointment, they're like, I know you have to go get your kids. I'll make it quick. And I'm like, okay. So that's another great thing. Yeah.
That's sweet that they know you as a person too, as a provider. Just one more before we move over to our compression gloves demonstration with Sarah. Someone else was mentioning they feel that their provider is a little bit impatient and they have a hard time getting responses via the patient portal. Is there a way to hack the patient portal? I'm guessing no, but
So I think this goes back to one of my slides where if the patient portal isn't working, try something else. Because sometimes it's a technology thing. So I'm in an office with two other providers. It's a very small office. And the other two providers I'm with, they struggle with the EHR, to say the least. So I help a lot with the EHR. I personally love the patient portal, but they're very slow on the patient portal. So if that doesn't work, try another way. Call and say, hey, I've sent 2 messages to Dr. Martin. Can you help me get through? And see what they say. Try something else.
It really does differ. I mean, I feel so lucky. My rheumatologist has had the same nurse for a decade, and her name's Jennifer, and my rheumatologist's name is Jennifer. So it's a little confusing, but Jennifer, the nurse, responds so quickly. And I'm just like, how can I bottle her and copy paste her for everyone else? It seems to be, it's very challenging, but thank you so much. You've given so many tips. I mean, I've been a chronic illness patient for 19 years and also an occupational therapist. And I learn things every time I listen to your talks. So thank you again for being here, and everyone check out what Lauren pasted in the chat about Stefanie's, links and offers and everything like that. So thank you again.